virus under control. 3 of those steps begin at 5 p.m. tonight. First, businesses will have a capacity guideline of 25% depending on their fire code occupancy. Gatherings will be limited to 50, and bars will be required to close at 10 p.m. All of these business guidelines are available at stlcorona.com. America had hoped to not be rolling back our public health orders, but the virus had other ideas. Some sort of steps in our public health orders will be necessary until masking and social distancing guidelines are widely followed in our community. Those are our 2 most powerful deterrents until a vaccine is widely available. As for restrictions on gatherings of 50 or fewer, there are certainly some exceptions. Schools, hospitals, urgent care centers, shelters, airports, and polling places. Businesses who have a 25% capacity limit aren't subject to the 50-person gathering rule. Those include grocery stores, retail stores, religious, spiritual, and memorial services. However, all activities will always require compliance with masking and other social distancing guidelines. As these restrictions go into place, the Department of Public Health is working on a process of closing businesses that flout the rules. The processes will give businesses a fair chance to comply, including a warning and a reminder and an opportunity to understand the guidelines and even get some coaching from our public health department. But if businesses continue to not play by the rules, then they will have to close temporarily to protect their employees, their patrons, and of course, all of us together. We are recommending that all people who are waiting their COVID-19 test results quarantine until those test results are available. And we know that will be difficult for many people. But we hope that employers will work with employees to allow them to quarantine whenever possible. The number of new COVID cases in our community is growing at an alarming rate. Last week, almost 10% of the cases in St. Louis County were positive. I mentioned earlier this week that we continue to have issues with some of our testing partners who have been overwhelmed and have been unable to comply with our rapid notification order to provide testing results to us promptly. The rapid notification order requires positive test results to be given to St. Louis County Department of Public Health within 4 hours and negative test results to come to St. Louis County within 24 hours. One urgent care provider had given us 17,000 test results in a batch over a 3-day period of time. Our county counselor talked to this provider, and we understand that they were overwhelmed, and they now have all hands on deck. They'll be working to stay in compliance with the reporting requirement, and we appreciate those efforts. The other local reporting labs and facilities have improved their communications with the Department of Public Health. We must have timely reporting of data so that we can make our public health decisions and share this data and this analysis with the public. The health department has received its first shipment of saliva tests. We'll be testing those on Tuesday and training staff on Tuesday to use that new testing process. And then on Wednesday, we'll be deploying those tests in our 3 testing centers in the community. We also hope to make these new saliva tests available to some of our federally qualified health center partners in the community. The department does have some concerns about rapid testing for COVID-19. This test can be less sensitive than the traditional nasal swab test for COVID-19. It's important that if you have symptoms of COVID-19 and you're sick and you have a rapid test and that test is negative, but you have a follow-up nasal swab PCR test. That means if you have symptoms and you have a negative rapid test, that test may not be reliable for a negative result, and you need to have a follow-up nasal swab traditional PCR test. Thank you, and I would be happy to answer any questions.
So is the saliva test just so that you have more tests out there?
Yes.
The idea being that it's quantity, and then that might be questionable, you need to resort back to the nasal swab?
So the saliva test is pretty reliable. It's not a rapid test. We expect to have results, at least the way it's working now, within 3 or 4 days. It'll be more promptly than some of the other testing supply lines. But one important thing about the saliva test is that it is a diversity. It's a new type of test. It's a new provider. We want to get as much different testing providers in the mix as possible, so we're not dependent on one chain. The rapid test is a finger stick test, and that tends to not be as reliable. An antigen test or an antibody test tends to not be as reliable for a negative result. And so if you're sick or symptomatic and you get a negative result from one of those rapid tests, you really need to follow up with a more traditional and more reliable nasal swab PCR test. The rapid tests are pretty good for a positive result.
Have the delays in testing been rectified, or are we still seeing
No, we
that?
still have national delays in testing. Our two major national lab Corps and Quest are struggling. They're overwhelmed because of the explosion of COVID in America. The testing facilities are overwhelmed. The machines are going as fast as they can. They do break down, and the testing companies are prioritizing hospitalized patients, sick patients tests first, and people who are asymptomatic go to the back of the line. Sometimes those tests are delayed, 5, 7, 10 days. And so we can certainly struggle to get information back in time to deploy contact tracers or case investigators in a way to impact the spread of COVID in our community. So those delay in test results are a real struggle for us and really inhibit our response.
With the rule of bars closing at 10 p.m. or last call being at 10 p.m., is the hope, or do you anticipate that you see the subset of the 20 to 30-year-olds, the higher numbers? The idea being that maybe they're the ones that are going to the bars. The idea being that if you can curb it at 10 o'clock, then maybe we'll curb the numbers as well?
Yeah, so the fastest rate of increase right now in our community is the 10 to 19-year-old. And we wanted to get that in check, and that's why we're struggling around the concept of schools opening, and that's why we've made a strong recommendation that we proceed with virtual schools or virtual learning in the community whenever that's possible. The 20 to 29-year-old tends to be out more at the bars and other gatherings, and we see that isn't the fastest rate, but that's where most of the numbers are coming from, because that population has so much COVID in it, so many positive COVID cases right now. So we know the bars is one gathering spot. We've seen the video. We've seen the lack of social distancing, and this cohort tends to be less interested in wearing a mask, and we have to work to bring them on board with all these social distancing measures that are necessary to keep our community safe. And so we've seen this around the country, and it was a recommendation of our public health department to close bars after 10. Bars will be limited to 25% capacity in St. Louis County, but any business that doesn't follow the social distancing rules, we'll give them a warning. We'll work with them to make sure they understand the rules, and then they'll have to temporarily close.
Is there anything to be said for the argument of focusing on bars that are non-compliant first, rather than a blanket policy of everybody having to close at 10? Just kind of curious.
Well, it's difficult in St. Louis County with 90,000 businesses to have someone at each bar monitoring them each night. And that's the challenge with any sector, any business sector that is associated with high-risk behavior or non-compliance. But we'll move forward. We think closing bars after 10 is the right compromise. That's what's been done in other parts of the country. And then we'll work from there. We'll either relax our restrictions or we'll tighten them up depending on where COVID goes in the next 4 weeks. But we know we have some challenging times ahead of us. Any questions, Doug?
Yeah, I have one from Public Radio. Did federal scrutiny advice factor into the increased restrictions on businesses that go into effect, specifically about the task force memo from last week that designated the state a red zone?
Well, sure. The CDC gives us advice. We've been communicating with the CDC on a regular basis, and following a lot of their recommendations. And one of their recommendations last week was that quarantining for 10 days was acceptable. Instead of 14, we made that adjustment. But we also recognize that Missouri as a state is trending in the wrong direction. The cases of COVID-19 are moving up from the south. People in Missouri tend to travel a lot, and we believe that that's associated with the increased rate of COVID in our community. But you know, the data from the CDC is important, and St. Louis County is part of Missouri. We do what we can to limit the spread in our community, and we've made some good decisions over the past few months, put us in a better place. But you know, we're in a state that is struggling, and we have to make some decisions here as a state, but also as a county to try and check the spread of COVID. If we want to give our kids a chance at in-classroom school this fall, we have to turn this around.
That's all I've got.
Okay, questions? Okay, thank you.